The Centers for Disease Control and Prevention released new guidelines on Saturday for camps to open safely this summer. The recommendations follow many of the same rules that CDC has issued for schools, including wearing masks, physical distancing, and limiting contact between children in different cohorts. However, several additions, including specific guidance for overnight camps. These guidelines are designed to protect children, the largest unvaccinated population, from COVID-19. And in general, they are great news for parents who can rest assured that CDC has got their back when it comes to getting a few sacred days away from the kids after a weird summer and a bad COVID-19 year. So here's a couple of guidelines that they're suggesting for this summer. Masks. The CDC announced on Tuesday that vaccinated people no longer need to wear masks outdoors, so long as they're not in a crowd. Camp is the exception to the rule, though. Vaccinated adults still need to wear masks when working with youth. All children above 2 years old are still supposed to wear well-fitted masks. Exceptions include activities such as eating or drinking or swimming and sleeping. Be sure to pack your kids an extra mask. One per day is good, so they can easily swap out dirty masks or wet masks with a clean one or a dry one, especially with the potential for summer sweat. Cohorts. For the most part, much of what we do this summer is already in small cohorts, that cabins do most things together. Most activities, most recreation, most games, most meals are all done with their cabins. So we're going to be limiting the mixture of cabin cohorts. We're going to be trying as much as possible to limit inter-cabin mixing as much as possible to reduce exposure. Physical distancing. 6 feet of distance is still needed between campers and staff, between staff members, and between campers of different cabins. So between people eating and drinking, it's hard to remain masked, and so we're going to be increasing our distance during those times. Campers within a cohort only need to be 3 feet apart, except for when they're eating and drinking. So for this reason, the CDC advises against close contact sports. So we're getting pretty creative with how we're going to run activities and recreation time together. Vaccinations. I want to emphasize the word should here. We are encouraging everyone who is eligible should get a vaccine as soon as possible. It takes a couple weeks for it to get into your system and to get to protecting you. And so we want to encourage people to get vaccinated as quickly as possible if you're available. Obviously, campers are not allowed at this point. The youngest studies right now are still 16 years old. And so most of our campers will not be vaccinated at this point. And so we are still encouraging parents and those who are able, staff especially, to get vaccinated as much as possible. And again, the word there is should, not must. Activities will be held outside whenever possible. Now, this is summer camp, so most of what we do is outside anyway. But sports will be played outdoors only. Staff and campers will have three meal locations to eat outside and spread out as much as possible. Indoor activities will be very limited. We'll make sure that when we do have to be indoors, that if it's an indoor specific thing, that we'll have some good ventilation to make sure that airflow is as good as possible. So if you're sick, one of the things that just makes sense is stay home. Because of variants that are out there in the virus, they have different effects on different people, and we are still unsure on how the vaccines are responding to each of the variants that exist. And so we are encouraging campers and staff that if you are sick, please stay home, regardless of if you're vaccinated or not. We're encouraging good hand washing. This is just a good practice to have anyway. Washing your hands is just a good thing to get used to doing. So we are going to require campers and staff to wash your hands frequently. If your hands are visibly dirty, please use a lot of extra soap and water, not just hand sanitizer. That doesn't really clean it as effectively as soap and hot water does. We do tend to clean our camp regularly enough as it is, but because we have active viruses going on, we're going to take a little bit more intentional efforts to be cleaning a lot more thoroughly. So touching contaminated surfaces is not a major way that COVID-19 is spread. However, we will continue to disinfect shared spaces, especially as this virus is still active. If few people are wearing masks, if hand washing is infrequent, and if people are using the camp, if they're at high risk for being exposed, then they run a greater risk of getting exposed to it themselves. The CDC has specific overnight camp guidelines that we will be adapting this summer as well. Many of them are the same rules that apply to your schools and churches that you're already familiar with, but there will be several differences and additions. The first of which is a pre-camp quarantine. Now, this sounds like really harsh words, but all we're saying is if you're a camper or a staff member, you should probably take a couple weeks before camp starts and just kind of lay low a little bit. This includes physical distancing, wearing a mask when you're not at home, avoiding unnecessary travel, and abstaining from indoor gatherings gatherings as much as possible. This will ensure that you're not bringing any extra viral friends with you when you come to camp. Getting tested. All unvaccinated people should get tested 1 to 3 days before heading to the camp. And really everybody should be tested because you just never know with the variants out there how your body could pick it up or not pick it up. We will also be doing screening for COVID-19 symptoms and exposure at registration as well as daily symptom checks. Now, kids are less likely than adults to seriously get sick from COVID-19. However, they can still transmit the disease to others, and some do have more severe reactions. And luckily, summer camp doesn't seem to fuel transmission of the virus as much as other things have. Last summer, only about 15% of all summer camps reported at least one case last summer. 15% is still a big number, but it's a lot smaller than it could have been. And that partially has to do with the summer, with the heat, with the outdoorsness, with the fresh airsness. All the things that we do at camp already helps with the virus. So these numbers are already low, but the vaccination of staff members will also help make camp a safer place this year. Summer camps are important for the spiritual, social, emotional, and physical development of our young people. Camps help to curb summer learning losses from school. They help keep kids active, encouraging them to develop social skills and give them a chance to try new activities that they may never have a chance to do other than at camp. The spiritual atmosphere that camp offers is just invaluable to a young person, but it's crucial to do camp safely. When choosing a camp for your kids this summer, I hope you'll consider entrusting your young person into our care. May God bless you and your family as you plan for this summer.